Hi, my name is Jessica Ignacio from BP Advancement, and today I want to share something with you, which is the types of movement terminologies. So I have here some movements example that I prepared for you. First, here is the flexion and extension terminology. And the first example of this is the elbow, which we also know as the forearm.
Elbow flexion, it occurs when the angle between forearm and arm decreases, allowing the ulna of the forearm to move closer to the humerus bone of the arm. In contrast, elbow extension, also called forearm extension, occurs when the forearm moves away from the arm, increasing the angle between those bones.
The next example of flexion and extension of the body movement is the thigh and hip.
Flexion of the thigh occurs when the angle between the femur of the thigh and the hip bone decreases as the thigh moves anteriorly. Thigh extension occurs when the angle between the femur and the hip bone increases as the hip joint straightens, and just like shoulder joint. This joint also allows movements past the anatomical position.
The next movement terminology is the abduction and adduction.
During arm abduction, the arms move away from the body's midline. During arm adduction, you add them right back toward the midline. Thigh abduction, the lower limb moves away from the body's midline, and during the adduction of the thigh, you add the lower limb right back toward the body's midline.
Then the next movement terminology is the rotational. And of course, the examples of the body movements here is first is the head.
The head can rotate laterally, either the left side or right side. Now returning the head toward the anatomical position is going to be medial rotation of the head.
Another example is the arm.
The ball and socket joint of the shoulder allows the humerus of the arm to rotate laterally or away from the body's midline, which is also called external rotation. It can also rotate medially or toward the body's midline, which is also called internal rotation.
Next movement terminology is the circumduction. Example is the shoulder.
So this would be a circumduction of the shoulder, and it's actually a combination of flexion and extension, abduction and adduction. So if I'm going this way, as my arm comes forward, I'm flexing and abducting, and then as I start to go around to the back, I am extending and then adducting. So circumduction is a combination of all those motions, so any joint which can flex and extend, abduct and adduct is also capable of circumduction. Another example is the wrist. This can also occur as circumduction like this.
The next movement terminology is lateral flexion.
So hands overhead and step to the right step and then laterally bend. Never force the range of motion and back to neutral. And then step a break and back into this lateral flexion moment. Notice also that the arms don't move independent of my trunk, and the trunk is allowing this motion through space. And one more thing, this lateral flexion, it's a great core exercise. Next is the neck. Slowly bend your neck to bring your right ear toward your right shoulder while keeping your shoulders in the same position. You can hold this position for 5 to 10 seconds and perform on the left side. You can also do 2 to 4 repetitions on both sides.
The next movement terminology is the elevation and depression.
In anatomy, elevation and depression most commonly describe movements of the mandible or the scapulae. When you move your mandible in a downward direction, depression occurs, and when you move your mandible upward, the elevation occurs. Similarly, when you move your scapulae up, the elevation of shoulder girdle occurs, and when you move them back down, depression of the shoulder girdle occurs.
The next movement terminology is the protraction and retraction.
Protraction moves the scapula forward or anteriorly and towards the side of the body, or laterally in an anterolateral direction, and the retraction is the opposite movements, and it's going to cause the shoulder blades to move back or posteriorly and more towards the body's midline, or immediately in a movement known as a posteromedial movement. When you bring it to the front and moving the mandible back is an example of protraction and retraction.
The next movement terminology is the dorsiflexion and plantarection.
During dorsiflexion, the back or upper side of the foot moves toward the shin, decreasing the angle between these two surfaces, leaving the toes pointing a little bit closer to the head. During plantar flexion, the sole of the foot moves toward the calf, decreasing the angle between those two surfaces, leaving the toes pointing away from the body. Hold your wrist of your right hand with your left hand. Now move the wrist in dorsiflexion position.
So we will proceed to supination and pronation.
So supination is the palm anterior, just like this one. This is the supination and this is the pronation. The pronation anterior. Another example is the forearm. This is the supination and this is the pronation.
Next movement terminology is the gliding movement.
The most common examples of gliding is just simply taking your hand and moving it from left to right in a waving motion like this. Next example is foot. You just need to wave your foot like this from left to right.
Next movement terminology is the lateral and medial rotation.
If you stand up and lock out your elbow and rotate your shoulders so that your thumbs start pointing towards your midline medially or internally rotate to the shoulder, now on the flip side, the thumb is heading back out. If you stand up and lock out your knee when the foot goes towards the midline, that's a medial rotation, and if it goes out, it's lateral rotation.
Next movement terminology is the opposition and preposition.
Whenever opposition occurs, the thumb moves and meets the tip of one of the fingers, and when you look at the shape, that results it kind of makes the shape of the letter O, with O standing for opposition with our opposable thumbs. Now, preposition is super simple because it is the opposite action of opposition.
And the last movement terminology is the inversion and eversion.
During inversion, the bottom of the foot turns so that it faces towards the body's midline. During eversion, the opposite motion occurs. The bottom of the foot turns so that it faces away from the body's midline laterally.
And that's all in this video. Again, I am Jessamay Ignacio, and I'm hoping that you learned something from me. Thank you for watching.